Hello and welcome to my presentation of vitamin K. Vitamin K is more formally referred to as phytomenadione. Its chemical formula is C31H46O2, and it has a molar mass of 450.7 grams per mole. This vitamin is a 2-for-1 containing two natural vitamins, vitamin K1, also known as phyloquinone, and vitamin K2, also known as menaquinone. The main difference between the two is found in their absorption rates, tissue distribution, and bioavailability. Vitamin K is a non-polar fat-soluble vitamin. It has a hydrophobic interactions and is lipid soluble. Vitamin K is essential for blood clotting. Proper absorption of vitamin K can contribute to the improvement of bone health and the reduction of vascular calcifications and cardiovascular risk. Certain kinds of vitamin K2 or menaquinone can be synthesized by cyanobacteria living in the intestine. The body's main source for vitamin K1 or phyloquinone comes from green plants such as spinach, cabbage, and kale. Vitamin K serves as a cofactor for the post-translational enzyme Y-glutamate carboxylase, which is an enzyme that converts certain protein-bound glutamate residues into Y-carboxyglutamate, or GLA. These GLA proteins are what support blood coagulation and are synthesized in the liver. These proteins also support bone formation and inhibit tissue calcification. A chemical reaction of carboxylation happens when an organic compound combines with carbon monoxide. This is a catalytic reaction. The ideal amount of vitamin K in the human body can be described as adequate intake, or AI. The AI of vitamin K for the average adult male, 19 years or older, is 120 micrograms. For the average adult female, 19 years or older, it is 90 micrograms. Vitamin K does not have a recorded tolerable upper limit or toxic dose. However, toxicity cannot be ruled out for an overdose of any supplement. Vitamin K deficiency, while rare, does occur. Some medications and antibiotics can block vitamin K metabolism. Any condition in which malabsorption of nutrients is an issue can cause a vitamin K deficiency. Breast milk contains a low amount of vitamin K, and as the molecule can't pass through the placenta, infants can be at risk of vitamin K deficiency. A lack of vitamin K can lead to uncontrolled bleeding, inadequate bone development, osteoporosis, and increased cardiovascular disease. A doctor can diagnose a vitamin K deficiency by using a coagulation test called the prothrombin time test, or the PT test. This test is done by adding a drop of the patient's blood to specific chemicals. The lab then observes how long it takes the blood to coagulate. Anticoagulants such as warfarin can inhibit vitamin K activation, so a doctor would check the patient's chart for this first. Conditions such as cystic fibrosis and celiac disease increase the likelihood of the patients developing a vitamin K deficiency because these are associated with fat malabsorption. Having any part of one's intestines removed for any kind of biliary tract disorder can have the same effect. Again, newborns are also susceptible to vitamin K deficiency due to either low amounts in transfer from placenta and breast milk, or the child's inability to synthesize due to weak liver or gut function. Vitamin K deficiency can be treated by a healthcare provider with a vitamin K supplement, or phytonadione supplement. This supplement is most often ingested orally. However, injections are available for those patients whose bodies are less apt to absorb orally. A doctor can determine the dosage based on the patient's age, overall health, and severity of deficiency. The average dose for adults ranges from 1 to 10 milligrams once, with a possible second dose 12 hours later. Here are my references for my presentation. Thanks so much for your time and attention.